You don't, what you do is you have the guidelines which do give you some background, but if the patient has given you what their goal is, you try to pick a quantitative test, and it doesn't have to be one of the clinical trial tests. It can be a 25-foot walk test instead of a 6-minute walk test, but you have to learn enough about how to standardize the test and run the test and have a script that you follow each time the patient comes in, and then you try to collect that data. And it's not data that you're used to collecting in a standard medical practice, so you may have to be creative and search out whether your physical therapy department or often it's the pulmonary function laboratory that will do these exercise tests. And they may be used to the 6-minute walk test, but it's not much of an adaptation for them to do a 25-foot walk test instead of a 6-minute walk test. And some of the walking implies moving on your feet, and the problem is when their patients are really severely affected, they may not be able to walk on their feet. So we sort of use a 25-foot walk test. It's less intimidating than a 6-minute walk, and we try to just get them to sort of mobilize however they normally do at home. And we've had patients that walk beautifully on their knees. They just can't support themselves from knee down. Their ankles aren't strong enough. And they actually have calluses on their knees because they've used them. They walk on their knees everywhere, and so now you'll test what they do routinely and see how it improves. And we have other patients that they're so immobile that they really don't move on their own, but they can still crawl, and you can test how well they can crawl, and it is a mobility test, and it's useful to know if someone went from 3 feet to 12 feet over the course of 6 months of therapy. They're having that sort of a general test of overall strength and ability to move. So it's a creative process trying to find a goal that the patient wants and then match a test to it. It's at the other end of the spectrum, the really healthy patient who's walking in the normal range. It's much harder to see an acceleration, a change, and you're always worried, they bounce around the normal range, and the walk test is not a maximal exercise test. They're not trying as hard as they can, so those patients seem to do better with a maximal exercise test. So you move them to the pulmonary function lab or a cardiac lab will do that type of testing. They'll have a bicycle that may fit the patient and be able to do maximal exercise tests, and there you get a real measure of improved endurance. You get because they push themselves to an anaerobic state, and at that point they generally will stop, and if it takes 3 minutes longer to get to that state, they've had a significant improvement, for instance. So each subpopulation has its own problems and challenges. The much healthier, you need maximal exercise test, and under 5 they can't do a walk test. You have to find other functional activities, and we usually will do things like a Denver or a Peabody or a BOT2, and it takes a more sophisticated person to run these. Usually it's a neuropsychologist or an advanced physical therapist will do it, and growth is always a very good thing to follow, and because everybody can do length measurements, or height is harder if they have a lot of joint and spine problems. Height is not so good, but you can always do a much more accurate length on a length board, for instance. We have to collect quantitative data. We have to be able to show the patient and show insurance companies or funding agencies, government agencies, what this drug is really doing for the patient. And in the middle of all of this, you have medical problems. Suddenly they need spine surgery. You've been going along nice and steady, and the spine surgery takes them off their feet for 2 months if they have a halo, for instance, or knee surgery takes them out of mobility for a couple of months. Then you have to try to make up that deficit. So you're doing the best you can, but dealing with a really challenging disease.